Welcome to our discussion on gestational diabetes. Today, we're delving into its significance, exploring how it affects both mothers and babies during pregnancy, and sharing essential insights you won't want to miss. What is gestational diabetes? Gestational diabetes is a type of diabetes that is first seen in a pregnant woman. Who did not have diabetes before she was pregnant? Some women have more than one pregnancy affected by gestational diabetes. Gestational diabetes usually shows up in the middle of pregnancy. Doctors most often test for it between 24 and 28 weeks of pregnancy. Who's at risk of gestational diabetes? Any woman can develop gestational diabetes during pregnancy. But you're at an increased risk if you are over 40. Your body mass index is above 30. You previously had a baby who weighed 4.5 kilograms or more at birth. You had gestational diabetes in a previous pregnancy. One of your parents or siblings has diabetes. You have had a gastric bypass or other weight loss surgery. If any of these apply to you, you should be offered screening for gestational diabetes during your pregnancy. What are symptoms of gestational diabetes? Gestational diabetes does not usually cause any symptoms. Most cases are only discovered when your blood sugar levels are tested during screening for gestational diabetes. Some women may develop symptoms if their blood sugar levels gets too high, such as increased thirst, needing to pee more often than usual, a dry mouth, tiredness, blurred eyesight, genital itching or thrush. How gestational diabetes can affect your pregnancy. Most women with gestational diabetes have normal pregnancies with healthy babies. However, gestational diabetes can cause problems such as your baby growing larger than usual, polyhydramnios, too much amniotic fluid, the fluid that surrounds the baby in the womb, which can cause premature labor or problems at delivery, premature birth, giving birth before the 37th week of pregnancy, preeclampsia, a condition that causes high blood pressure during pregnancy, your baby developing low blood sugar or yellowing of the skin and eyes after he or she is born, which may require treatment in hospital, the loss of your baby. Having gestational diabetes also means you're at an increased risk of developing type 2 diabetes in the future. How does gestational diabetes affect your baby at birth? Gestational diabetes increases the risk that your baby will have certain complications at birth, like delivery via caesarean section, large size for their gestational age, breathing problems, jaundice, low blood sugar immediately after birth. Tips for women with gestational diabetes: eat healthy foods, exercise regularly, monitor blood sugar often, take insulin if needed, get tested for diabetes after pregnancy. Thank you so much for watching. Feel free to leave a comment down below sharing your thoughts or suggestions for future videos.